Now with my hands, why do I sometimes get numbness in them?
There's several common reasons for numbness and tingling in the hands. The most common by far would be carpal tunnel syndrome, which is a compression of the median nerve at the wrist, the nerve that supplies sensation mostly to the thumb, index, middle, and ring fingers.
Can I do anything instead of surgery?
There are some theories that you can do physical therapy where braces, anti-inflammatory treatments to decrease the swelling around the nerve, which may help to alleviate the symptoms of carpal tunnel syndrome. There's no question in patients that have numbness when they sleep or are awoken at night by numbness in the hand that wearing a brace that holds their wrist straight can sometimes prevent those symptoms. And it's certainly something they can try prior to surgery.
If I do need surgery, will surgery help my problem?
In most cases, when in patients who have intermittent symptoms, meaning they come and go, surgery will usually cure the problem. So most of their symptoms will go away almost immediately. In patients who wait a little longer to have the surgery done, where they have numbness all the time in the fingers, that can take a long time to come back, even up to a year sometimes before they get full recovery. And in some cases, if the symptoms have gone on too long, they can have permanent damage to the nerve, which won't fully recover.
So the numbness and tingling can come back even after the surgery?
Most of the time it won't. There are some cases, especially in patients with diabetes and some other health problems, where recurrence of carpal tunnel syndrome does happen. So sometimes 10 to 20 years down the road after a carpal tunnel release, people can get carpal tunnel syndrome again. But that's not typical for most patients.
How long will I miss work after carpal tunnel surgery?
Missing work always depends on what patients have to do. What I usually tell patients is no forceful gripping or heavy lifting for at least 2 weeks. If they have to do a lot of heavy lifting, then you're probably looking at 4 to 6 weeks.
Can I use my hand right after surgery?
My usual rule of thumb after carpal tunnel surgery is no heavy lifting or forceful gripping for 2 weeks. So any simple activity that doesn't require heavy lifting or tight gripping they can do right away. It is quite sore after surgery, so the first few days it can be uncomfortable, but most patients can do simple things right after surgery.
Will all of my numbness go away after surgery?
The ability of the numbness to go away after surgery depends a little bit on how bad it is before surgery. So patients who have intermittent symptoms where it comes and goes, where their sensation comes back to normal at times, usually that will go completely back to normal after surgery. Patients who have constant numbness in the fingertips where they're always numb, never goes away, that can either never come back sometimes, or in some cases will come back very slowly. Nerves heal very slowly. It can take up to a year sometimes for that to fully recover.